Whether it is Colombia or it is Brazil, you were talking about travel advisories, and you're talking about advisories given to women not to get pregnant. You have a lot of panic going on from a lot of people. It raises the question: if a woman or one traveled to any of these areas, no, but before we talk about the travel, microcephaly, you mentioned that. Is there a suspicion, or is there a laboratory fact that Zika is linked to microcephaly?
So far, it's just a linkage based on the time that Zika first arrived in Brazil and when they started seeing cases of microcephaly, right? So Brazil said that prior to the Zika outbreak, they only had about 150 cases of microcephaly every year. Right? So let's be clear, microcephaly happens even before Zika.
Yes.
There are other viruses that cause it, other toxins, alcohol in pregnancy, those sorts of things can cause it. And of course, after the first few cases were detected in Brazil, they noticed a tremendous increase. And they said there were up to 4,100 cases of microcephaly since the outbreak began. But you see, there are lots of questions about this, right? Because we don't know if that baseline of 150 cases was actually an accurate number or not. We don't know if the 4,100 is an accurate number or not, because there are other reports coming out that while in looking through the 4,100 cases, the work is still being done, so nothing definitive has been published yet. They're actually finding that there were over reports of microcephaly and that several of the cases were not in fact microcephaly.
And that's one of the areas too, because the heightened awareness of a medical condition is going to bring you a lot of people claiming it is going to inflate your numbers. And until the facts are out there, then everybody can be saying the sky is falling, when in fact it's just the cloud, but nobody mentioned it before.
Exactly. So that we also see that there's a geographic distribution of the cases of microcephaly. They all seem to be clustered, more than 80% of them in the northeastern part of Brazil. But we understand that Zika is everywhere in Brazil. So why would there only be microcephaly in that part of the Brazil? Is there an environmental factor, So there's so many questions that are not answered yet. That is why we certainly would not say it's any confirmed link. That information probably will still take a while in coming, because proving that is going to be really quite
difficult.
a challenge.
Take a little while. We take no pleasure at all in saying this, except that we are thankful for the fortune that Trinidad and Tobago has not registered a single Zika case, and we just want to make that very, very clear. Outside of Brazil, the link to microcephaly is one that is being studied right now. I do want to go into the area of travel with the limited time we have, because a lot of LAAD, for instance, has been rescheduling a lot of flights. A lot of folks are canceling their flights to places where it is reported that there is a Zika virus. A woman has traveled to an area, for instance, where Zika is suspected, and she gets back home here in Trinidad. What would you advise her? She's seen no sign of no symptoms no whatsoever, but she was there, she got pregnant, or got there in the early stages of pregnancy. And before you even answer that, let me ask you to clear this up. If you are pregnant and you get to an area where there are cases of Zika, is there a greater risk there, or a greater risk when you get pregnant in the area?
We don't know yet, because the thing is that they're not sure if there is in fact an association, a clear association. Is it that it's in the first trimester? Is it only that there is a problem? So I would say that any pregnant woman who's traveling anywhere where there are mosquitoes, certainly where there is Zika or any other disease, because a pregnant woman can just as easily get dengue or chikungunya, which puts them at higher risk of serious complications. Right? To take personal precautions to avoid being bitten. Insect repellent that is safe to use in pregnancy. You just need to read the label. There are natural, of course, insect repellents that people can use if they so choose. Wearing long sleeve clothing, long pants, light colored clothing attracts mosquitoes less. And of course, sleeping under a bed net is also very useful. Those are the basic messages that we've been talking about since, we've been talking about, mosquito-borne diseases, and they work, So, of course, it's very difficult to say, 100% that, this will work, but taking those precautions are the best things you can do to avoid being bitten.
Dr. Adele Chen, who is the medical officer of Health St. George West, the reason we had you here, and you have achieved that very clearly, is to get rid of some of the garbage surrounding the information we're getting, because one of the things that folks have to be very clear of, this issue of microcephaly is not only attributable to or suspected. It can happen if you are malnutrition. There are many variables that folks, if you have someone with a deformed baby, don't throw your hands in the air and say it is Zika or it is this, because a lot of things can contribute to the deformity of the head, as it were. Is that correct?
Absolutely. I mean, there are environmental toxins, there are viruses, there are, different things. And even then, at a baseline, it's difficult sometimes to say what caused it. So, I mean, certainly Zika can potentially be another cause. But I think we have to be very guarded in the way that we panic our pregnant population and panic the world in terms of thinking that this is an eventuality.
I always like to get down to the bottom of an interview to be very clear and do what is like a synopsis. We are saying then that no virus is to be taken lightly, no illness is to be taken lightly. However, being armed with the information that you can have it, there are some symptoms that will pass normally after a while. However, pregnant women are at the elevated risk level. Am I correct in saying that?
In the absence of more information, certainly. We will definitely want to treat pregnant women as if they are at higher risk until we know more. The Ministry of Health, of course, has responsibility for the health of the population, and we prefer to err on the side of caution and ensure that our pregnant women are safe and recognize that their interests are being sought to ensure that they are not exposed to anything untoward. This is why the Ministry of Health has to continue to push the message of source reduction. Although Zika is not confirmed to be here yet, we have the vector here. We breed it. They're like our pets. The Aedes aegypti mosquito. So, looking around our homes for sources, the message of source reduction still has to be the overwhelming message, because it's the only way that we could control the population. So looking around our home once a week, looking for the clogged gutterings, the vases, the empty pots, the tires, all of the things that can collect water.
And I'm encouraged by what the minister said. He's taking a bill to Parliament to ensure that we increase the fines for those who do not clear debris on their property, particularly unoccupied property. And that is going to help with that whole source question.
Absolutely. It's so easy to look at our neighbors, and we know that there are issues, of course, with overgrown lots and people who don't take care of their property. That's a problem we definitely have. But sometimes the innocent homeowner can look around their home and sometimes not see things that are there. In my own property, I looked around last week and there's a storm drain, and I didn't realize it was collecting water and because it's not graded properly. So it's something that has to be taken care of, and I certainly don't want to be guilty of breeding mosquitoes.
Understand. And some these things can breed even in a cap.
Absolutely.
I mean,
very,
a bottle
very little
top,
bit of water.
right? That's all they need. Dr. Adele Chin, thank you so much for taking the time to be with us this Sunday morning, coming in to have brunch with us. I truly appreciate your clarity.
Thank you for having me.
Thank you so much. You have yourself a wonderful day and a good Valentine, whatever that is.
You too.
Take care.